Hello beautiful people and welcome back to this channel. This is Hilda and you are watching Aging Happily with Hilda. In today's video, I want us to talk about signs and symptoms of over-medication. I actually brought this up because following one of my previous videos, there was a comment and somebody really wanted to know the signs and symptoms of over-medication. If you remember, I was talking that day about over-the-counter medications and the interactions that can come with these medications, especially if you take them along with prescribed drugs. How is it going to affect you? What will be the outcome? That's why I'm here today. So our topic for today will be the signs and symptoms of over medication. This way is just going to help you to identify if you feel if you are thinking you have been over medicated. It's just going to be a trigger for you to know exactly your state at a particular moment. And before we get into that, guys, I just want to take this moment to thank you all for your support. If this is your first time to this channel, welcome. We share health tips. We encourage people to embrace aging happily. Remember, aging is a natural process and nobody has control over. So we don't need to stress so much about the aging process. We talk about the lifestyle that can help us to embrace this aging happily. And of course, we talk about our lovely seniors. We cannot talk about the aging process without talking its end products. I step in once in a while and just talk about this lovely senior. Share this video to your loved ones, to your family members, to your friends, to your colleagues. You know what? Knowledge is power. Some people do this or take medications unknowingly. They over-medicate themselves without knowing. Some don't have the knowledge or the consequences. They don't know the consequences of the medications they are taking. So be a helper. Help somebody out there by sharing this video. Let them know the signs and symptoms. And the good thing about some of our medications, we always have antidote that can counteract the effect of any medication that you take. So if people know that they are over-medicated and they know those signs and symptoms, they have the trigger, it is just easy for them to talk to their health professionals, to their doctors. That way they get a better advice and minimize any consequences of being over-medicated. So guys, please share this video if you want to touch a life out there. Remember, here we are talking about things that can help us to age happily, and health is wealth. I would like to mention this. When you are over medicated, this is what happens. You feel some symptoms. It could be maybe physical, it could be mental, psychological. Maybe you just feel sick. And what happens? You want to go and consult with your doctor. When you consult with your doctor, what happens? They give another prescription. What happens with the next prescription? It's going to interact with the previous medication that you just had. And the process continues just because of a simple or just one medication that you took. The side effects of a particular medication, or because you took a particular medication severally, you didn't respect the dosage for that medication. You ended up having another complication from over medication. Please, if you get any of these symptoms, don't hesitate to get to your healthcare provider. Fatigue and energy depletion. You feel tired. You feel depleted. You don't have any stamina. It's difficult for you to do things. Another sign and symptom is pressure in the abdomen. It really depends on the medication. You feel stomach discomfort. We see this with some of our seniors in the long-term care. We have families bringing some of the over-the-counter medications to their loved ones in the nursing home, in the hospital. So when they take them together, you don't know the compositions, they end up being over-medicated. I will take an example for just a simple Tylenol. So many over-the-counter decongestants, they have acetaminophen composition. When a client is being prescribed with Tylenol and you as a family member is bringing that over-the-counter decongestant, that's already too much medication. You don't know how you are going to manage that. At the end of the day, you will take too much of that Tylenol. Another sign and symptom that you can observe is aches and pains in the body. There are medications that you can take and you just be in pain. If you're tired, if you're feeling depleted, and you just kind of bed bound at a particular time, you feel pains. And that's just because you over medicated. It could be taking so many medications at a time or taking overdose of a particular medication. It doesn't matter. Problems with balance and motor skills. You know there are some medications when you take, you are even unable to hold a cup. Your gait is not stable. That's a sign that you are over medicated. Another sign and symptom is fatalities and falls. I just mentioned gait. Your gait is not stable because you are taking a medication. You are taking a particular medication too much. It can disturb your balance and eventually lead to falls, especially with those older adults. Rashes, flushing of the skin. If you are noticing that now and then, over and over, it should be a trigger. You should know something is going wrong. Check with your physician and just let them know what you are taking, especially if you're having an over-the-counter medication in addition to your prescribed medication. Also, weight gain or loss that is not clarified. Imagine somebody losing weight constantly and we are unable to identify what is really causing that. And if you are unable to identify the causes, the consequences, the side effects of that particular medication you are taking, it could be the medication that is causing you to lose weight. Somebody on diuretics, for example, you're losing water when you take diuretics. If that's a call for concern, touch base with your doctor. They can always advise on something that you can take to keep up with your regular weight, irrespective of that medication that you are taking. Remember, I said curing one thing can lead to a complication of another thing, and the cycle may continue. Another sign and symptom is mood swings are frequent, and there is a lack of personal hygiene, self-care. You are moody. It happens again with older adults. They just feel weak. They just feel moody. Some are just crying. They cannot explain. It's time for you to look into those medications. Make sure they are not having some extra medications from family that is causing that over medication or some sort of drug interaction. Concentration problems. It is difficult sometimes to concentrate when you overtake medications. Impairment of memory. Yes, if you didn't know this, I'll tell you. People take some medication and it's causing them to be forgetful. They're losing their memory because of a particular medication. If you think your loved one is taking a particular medication and you begin to notice that loved one is forgetful, it never used to be like that, or going off, very difficult to remember things, to identify even his or her own family members, there is a problem somewhere. Check into the medications. We always advise touch base with your doctor all the time. Another sign is confusion or cloudiness of the mind. You are just confused. You take some medications, you just get confused. You overtake medication, you get confused. Medications is there to help us with our health issues. Too much of a thing, as they say, is a disease. Taking too much of that thing that you are trying to cure a particular illness can cause another problem. Delayed decision making. Yeah, you might not even know how to go about decisions. It will be difficult for you sometimes to even take a decision just because you are taking too much of a particular medication. Inability to think rationally. Yeah, impaired memory. You are unable to think accordingly. You don't reason well with others because you are over-medicated. That's a trigger. If you notice maybe a loved one arguing with somebody that is strange to you, yes, that is huge. Think about it. Look into the medications. Make sure they are taking it the right way. Psychosis, hallucinations, and delusions. That is very clear. You see people hallucinating because of over-medication. Again, symptoms of withdrawal when not using. If you already love to take a particular medication, do you know there are times that even when they instruct you or they advise you not to take that medication, irrespective of you knowing the consequences, the side effects, do you know it's still going to be difficult for you to get off that particular medication? They may take it off your home. When we get into any home, you are able to identify where the medication cupboard is. Do you know you can actually steal a medication just because you are used to taking that particular medication? So if you are feeling that way, or you see a loved one already in that state of having problems withdrawing from taking a particular medication, you need to work hard on that. Talk to the doctor. They will see if they can give something to help that situation out. That's actually the end of this video. I trust you love this video, guys. Please don't forget to hit the notification button so that anytime we upload a video, you will be the first person to be notified. And as always, I love you guys. Share this video, and if you are not part of this family yet, don't hesitate. You will love what we share here. Thank you again. I look forward to see you in my next video. Stay tuned, guys.